Well, hello and welcome to today's ATU faculty webinar. My name is Christopher Schmidt and I am the education lead for ATU. In this role, I am your faculty contact and support liaison for all things related to ATU. I've also been involved in athletic training education in various capacities for quite a while, and I've taught in and directed athletic training programs at both the graduate and undergraduate levels. In addition to those academic roles, I've also held multiple volunteer leadership positions in our professional associations. I'm pleased to see all of you today, and I want to thank all of you for taking some time out of your busy schedules to join us today. We are recording this session towards the end of May 2026, and as such, I want to acknowledge that May is Mental Health Awareness Month. So as caregivers, clinicians, educators, students, innovators, it's important that we prioritize our mental health as we serve others. So I certainly hope you have taken the opportunity to do that sometime this month or that you will sometime soon. With that in mind, and for this faculty webinar session, we'll explore the mental health and rehabilitation app in ATU, as well as the macro simulations, also known as macro sims, in the corresponding mental health and rehabilitation simulations app. So my goal today is to help you discover some practical ways to integrate these resources into your teaching so that you are equipped to help students better recognize, respond to, and support the psychological aspects of injury and recovery as they learn to care for the whole patient. But before we get started, I do want to introduce a couple of my ATU colleagues who are joining me today, James Sims and Phil Ford. So both James and Phil will keep an eye on the chat. So if you have any questions or comments during the webinar, please go ahead and post those there. But also after the webinar presentation has concluded, I will stop the recording and give everyone a chance to unmute themselves to fully participate in the discussion. But please know that for now, everyone's audio and video are muted. So, as I reflect on my own teaching experience, I was very much siloed as an educator in teaching orthopedic assessment, therapeutic modalities, pharmacology, similar courses. But when the NATA adopted the ICF model as the disablement model for our profession, that was really the impetus for me to begin teaching from a biopsychosocial spiritual approach and bringing that into orthopedic assessment. But I recognized that doing that probably was artificial. It felt very sterile, very clinical. And I'm sure many of you can relate to the common challenges that we face in teaching mental health. And this is just in my opinion. I think probably a lot of us can think of a few other challenges that we face, but one of those might be the variability in our own education, our expertise, a high level or a lack thereof, some understanding or misunderstanding amongst our faculty colleagues, or maybe we don't have the community resources readily available, or the resources that we do have a variability in that education expertise. And even amongst our students, there might be a variability of prior education or expertise, or some things around mental health that may be barriers and that may be a challenge for all of us. And certainly, I can relate to this. Another idea that I was thinking of, this lack of exposure for our students, or a lack of integration across the curriculum, and then even during clinical education. We have limited retention of information and competence over time because of that lack of exposure. It is the old adage of if you don't use it, you lose it. In the program that I most recently taught in, we had this content in one semester in a 3-unit course in the second year, in the fall semester of that second year. And even in my own post-professional education, I had one course in graduate school on behavioral management of the injured athlete. And because of those limited opportunities and limited integration, there's also a limited opportunity for clinical reasoning development and practice. I mean, how often do our students get the opportunity in clinical experiences, in clinical education, to identify, to refer, or even give support to a patient with behavioral health conditions. And then mental health in general. In our society and in our communities, in our professional circles or personal circles, there may be a stigma or a bias around mental health and a diagnosis, or we may say, as we look at our own scope of practice, well, that's not really what I do, or that's not my job, that's not my role, that's not what I do. So we may have some difficulty in defining it or categorizing it within our own professional scope. But as educators, right, we have this responsibility to prepare students for clinical practice and whatever variation in shape and form that might take. So are our students prepared to notice signs and symptoms of behavioral health conditions, mental health conditions? Are they prepared to address those risk factors with a patient or client, or with a family member, or with a friend or caregiver? And then once that they are able to do that, do they know how to refer, and who are the proper practitioners, or what are the community resources that they have available? So we've created both the app and the simulations to address those challenges that we've all faced and continue to face, because we believe that all of you as educators and your students deserve tools that are available as quick reference guides at their fingertips in the classroom, in the lab, or in the clinic, and resources that prepare students for the realities of athletic training clinical practice through those simulated immersive experiences. So before we jump in, I want to show you the content, the simulations. I would like to, at this point, recognize and say thank you to the two primary authors of these resources. One of those is Kunman Lee. Kunman is a physical therapist who's worked in a range of clinical specialties across both inpatient and outpatient settings. And then Dr. Jason Wong. Jason is a licensed clinical psychologist and is the assistant director and training director of the counseling center at Pepperdine University. And both Kunman and Jason were very thoughtful about structuring the apps and simulations content around the needs of the rehabilitation professional and the types of patients that we commonly see. So at this point, I'm going to switch screens. I'm going to go into ATU and show you where we can locate the app, go through some content, and then take a look at the simulations that are available for us as we support our students. So within ATU, again, this is our landing page, our lobby, if you will. And so all of the apps are organized alphabetically by color. So the didactic orange apps on the left-hand side and the e-learning module simulation apps on the right-hand side. So we're going to be going in both areas today, but they are organized alphabetically. So for today, we'll be in mental health and rehabilitation. So that's where you can find that. You can certainly also filter these out by categories, or use that nice enhanced AI powered search engine to find the content that you're going to need. But today we're going right into the app, mental health and rehabilitation. So, well, let me actually go back. One of the things to be practical is give you some ideas and suggestions to my colleagues, to my peers in teaching this content area. To begin teaching mental health, I think one of the things that we can actually start with is the fact that mental health is here in the ATU suite itself, and it's always available in the suite. This is not a standalone resource that's siloed somewhere else. You and your students don't need to leave ATU to find mental health and rehabilitation resources, nor do you have to wait until that mental behavioral health course in the curriculum. It's here. Everyone has access to it from day one when they start the program, as they matriculate through the curricular content and clinical experiences, and throughout each course. It's also here alongside, maybe we would consider our standard apps like orthopedics and gait and emergency care and physical agents, right? It is not, again, siloed. It is here with all these other content areas, kind of these pillars of our curricula. And this, I think, demonstrates that it's a valued and critical area, much like those others. And I believe that kind of normalizes it. It helps us to become comfortable talking about these disorders, conditions, reduces the stigma and bias. And there's an opportunity for us and our students maybe to even use these resources along our own mental health journey. So we've got these resources at our fingertips. In addition to it being here, students have access to it. We don't have to go other places to find this content. I think during student onboarding and orientation, a really good best practice, if you are using ATU across your curriculum, is to spend some time as you onboard a new cohort doing a demonstration of ATU, how you plan to use it, what apps, what simulations you're going to use, maybe by course or by semester or by year, and then certainly identify, specifically highlight mental health is here alongside all the other content that we have in the app. So there's a lot that we can do as educators to show this resource, that it's here, and that it is important, just like orthopedics or physical agents or post-op or any other app that we might have in the suite. So I think those are just a couple of ideas to get started integrating the app into your teaching and into your curriculum. So as we look at the app itself, I just want to show you a little bit of the demonstration of the content. We don't have the time, the bandwidth to really talk through every disorder that's here, but I want to give you enough so that you can look at this on your own as you have time or as it relates to your course or curriculum. So as we open the app itself, we will notice that in this app landing page, it's organized by 7 categories of disorders. Those include anxiety disorders, bipolar and related disorders, depressive disorders, feeding and eating disorders, obsessive compulsive disorders, schizophrenia spectrum disorders, and then trauma and stressor related disorders. And we're going to be using one of those categories, an example in there today. But I also wanted to identify that you've got kind of an A to Z list of screening tools. So if you wanted to just see those, you could click on screening tools, and that will show you all of the assessment tools, the common assessment tools that we've got in the app, and we'll be using one again today. So let me go back to the main page of the app. I also wanted to show you that there are therapeutic techniques, again, kind of an A to Z list. So if you're just looking at recommended, suggested ways to approach these conditions, disorders, here's that kind of all therapeutic techniques list. And I think this is a great way to embed this content into a therapeutic interventions class. Maybe you're teaching physical agents or therapeutic interventions or rehab or something like that. And we're doing a lot of great work in teaching cryotherapy and thermotherapy and electrotherapy and pharmacology and all those other things. But let's look at therapeutic techniques for mental health conditions. Again, it normalizes it. It allows us to talk about it and shows this as a great resource. Also, at the bottom of this app kind of landing page, there is an app information section, right? So if you don't have the time to go back through and maybe watch this webinar again or go through the presentation slides, there is a shorter app overview video that I recorded that you can look at here, and you can see the description and then our list of contributors and authors. And then I also wanted to point out the curricular standards guide. Right now, all of the apps and simulations are mapped to the 2020 edition of the CATIE standards. But as we're recording this in May 2026, I am currently working on the new revised crosswalk and map for the 2026 edition of the curricular standards, and then the most updated BOC exam references. So those will be provided for you as soon as possible. But again, I wanted to highlight that those are also available in this particular app. So to see a content about a specific disorder, we're going to click on that category to see all of the disorders in those categories. So I'm going to use anxiety disorders as our example today. And you'll see why I chose this when we look at simulations. So anxiety disorders, we see there's 3 that are listed here: generalized anxiety disorder, panic disorder, and phobia. So we're going to look at panic disorder as our example. And then all of the conditions that are listed in this app have these same 5 subcategories, beginning with diagnostic criteria, prevalence, functional consequences, applications in rehab, and then medications. And I think even right here, we can see some natural connections and some natural integration and embedding into courses across our curriculum. When we look at diagnostic criteria, and I'll click there. So these are all going to be from the APA DSM-5. So panic disorder, here's the criterion A, B, C, D, right? But and the mental health and rehabilitation app is a text-driven app, right? Unlike some of the other apps or most of the other apps we have in ATU, it's not motor skill driven or video based, but this is a quick reference guide, but it's bulleted. It's still short. It's still approachable information, and of course, reference with relevant professional evidence. But diagnostic criteria, here are from the DSM-5, those characteristics and criteria. As I'm thinking about that orthopedic assessment class and thinking about those patient case studies, or thinking about SPs or OSCEs or whatever it might be, I'm going to start pulling from some of these signs and symptoms and adding it to that subjective assessment or subjective evaluation to begin to help our students take the blinders off and begin to look at and think about, now, what do you think sweating, trembling, shaking, chest pain, discomfort could be, right? And the student's thinking, oh gosh, it's something cardiovascular. It's like, well, no, they're coming in for wrist pain, but what else could this be? Let's begin to think outside that, very laser focused kind of orthopedic musculoskeletal box. So here's the list. All these conditions have that. Begin to build those in to those patient scenarios or paper cases or whatever you might be doing. So every condition has diagnostic criteria. Next, if we look at prevalence, again, this is going to give us the prevalence data of the disorder in the United States and other countries, and age and lifespan differences, if they exist. So prevalence, you'll also see prevalence data in the orthopedics app, and we've done some really good webinars and deep dives on there. Prevalence data, epidemiology is one of those key important legs of the three-legged stool of EBP. So if you're teaching evidence-based practice as a standalone course or embedding it again, or research methods, why not also include mental health and rehabilitation considerations in that conversation about epidemiology? We're looking at panic disorders, the general population. What's the prevalence? 2-3%. Okay, and if I'm working with a patient that has other demographic characteristics like Latinos, African Americans, Asian Americans, Caribbean Blacks, right? Then I can think about, this could be a very prevalent condition in this patient population that I'm working with. So begin to embed it across the curriculum and not just, again, this kind of standalone siloed course. So next in the list of 5 subcategories are functional consequences. And these are just short, approachable, bulleted lists of how a patient might present with that disorder and how that, how their biopsychosocial spiritual function might be impacted by their experience with that disorder. And so, function is what we do, right? We are all about returning our patients, our clients, our athletes back to return to sport, play, occupation, activity. And so if someone is suffering from panic disorder, what might we see? High number of medical visits and greater healthcare utilization, increased disability, poor quality of life. Those are impacts on their function of daily life. And I think, again, we can embed those in the orthopedic assessment scenarios, in that story that we are trying to write, and have the student key in on certain functional impacts of panic disorder in this particular example. Next are the applications in rehab. And so this is where both Kunman and Jason, our app authors, really worked looking at the conditions and then how does this apply into our rehabilitation settings. So these could be embedded, again, in that therapeutic rehab, therapeutic exercise, corrective exercise, therapeutic interventions course. What are the applications? How does this impact? And what is the impact of exercise? So one of those is screening tools. So first, we're presented with this list of screening tools that relate to this particular disorder. And so I just want to show you one example, Beck anxiety inventory. So if I click there, it's going to give us information about the purpose, overview, the psychometric properties, and embedded in ATU is a link to the tool. So if I click on that link, here we go. Here's the Beck Anxiety Inventory. Now I could download it. If you had a tablet with a pen and the technology and the software, right? You could even use this, I suppose, as a patient-reported outcome measure. But it's here freely available for you to use within ATU. You don't have to go find it. Students have access to it. They can download it, fill it out, use it in their clinical environments. And so wherever you teach patient-reported outcome measures, right now we've got that list of screening tools. And that's exactly what these are. And so embedding in that the mental screening into that intake subjective exam. And so I'm just going to close out of here, right? And then I'm going to go back into applications and rehab screening tools, which is always there, and therapeutic techniques. Right. So these are those that have been identified specifically for this particular disorder. And these are just suggestions. These are in no way prescriptive. We do have to be cognizant of scope of practice and what things that I am allowed to do in my role, whether that's statutory defined or job description or whatever it might be. These are just some ideas of ways that we can help this patient, client, athlete deal with this. So one of those, expressing empathy, right? It's short. It's a brief definition. Here's an acronym that can be used for expressing empathy, some communication, what we might say, helping our students with the right words. I often find that's a challenge in helping them communicate, put your words together, what this might sound like. They can practice. How would they express and show empathy? So again, in a physical agent modalities or therapeutic interventions class, right? How would you show empathy for this person coming in? And they're just there for this treatment, but they're feeling really anxious about it. And they really, their heart is pounding and they're sweating and they really are showing these signs of panic. So how could I use expressing empathy? Right. So there's quite a few others that are listed there, but I want to move on. So precautions is the next subcategory. And so these are lists of signs and symptoms and comorbidities to note and take into consideration when we're designing or modifying that rehab process. So if we're identifying that they may have panic disorder, recognize that, their nervous system is going to be operating at a very high level. So as we design the rehabilitation program, maybe we want to stay away from, or we need to be cognizant of COPD or IBS or asthma, dizziness, especially making these symptoms, signs and symptoms worse when we're doing some aerobic activity or whatever that might be. And then the last category in the applications of rehab are movement-based management. So we are all movement professionals, exercise, sport, activity, occupation. And so how can movement help assist the person in dealing with that particular disorder or condition? So, again, this might be useful in a therapeutic exercise course, therapeutic intervention. So what is the effectiveness of supplementary exercise for this? What would be some ideas, some suggestions, again, not prescriptive for that exercise prescription, then appropriate references as they might apply. So lastly, on the content side of the medications that are involved, and so I do want to let you know that all of these medications are internally hyperlinked to the standalone pharmacology app in ATU as well. But these are the ones that are specifically identified. Again, Jason and Kunman identified these as treatment options. And so again, here's the list. If we just looked at one, sertraline, Zoloft, as that page loads, you'll see it open in a separate window, which I think is really super helpful. Now I don't get lost. That external linking page opened and is a separate tab, so I'm not losing my place in line with the app that I was looking at. But then I can go through again, what is the pharmacology information that we've got listed for that particular medication and intervention. So great for a pharmacology gen med class, wherever that might be housed in your curriculum. So at this point, I know it's a lot of content, but now I want to go back into the simulation. So that's the content side of the mental health and rehabilitation app. But we understand, and we talked about at the beginning of the webinar, the challenges of students being able to apply their learned knowledge. I mean, how many times will they actually have this in real life, in a clinical environment, in clinical education, that they can interact with a patient with a mental health condition? So we have got 4 simulations. So I'm going to go over to that mental health and rehab simulations app. And as that opens, you'll see that these are macro sims. So if you're familiar with our levels of simulation and e-learning in ATU, this is actually the highest level of simulation. Macro simulations, they are longer to complete. So you'll see our estimate on each of these is about an hour, give or take. That's probably a high watermark. But macro sims are, a student has had probably a majority of the curriculum. They've got some prior knowledge. They know the content. They know how it's applied. Now they're ready to show it, do it, apply it in a real interactive environment. So just know that this is the highest level of simulation that we have. But as you see, and as you play these yourself, they are approachable. So we've got 4, part 1 and part 2 for anxiety symptoms, and then part 1, part 2 for managing individuals with depression. But as I show you some of the examples that I've got pulled up, you'll see that there's a nice blend of informational content and application of learned content, as well as assessment. So we're really supportive of the student going through this, the user, the learner. So it's not they're not going to be stuck. There are a lot of supportive hints along the way and informational pages. So just to kind of show you, and we're going to use the managing individuals with anxiety symptoms part 1 today. So I'm going to pull this up. Just a brief reminder that all of you have the educator key. So you can click on that educator key, and this is going to pull up 40 plus slides that you could then scroll through and read the objectives. You can see the overview, read that. And again, keep in mind that our simulations have been updated to the Web Content Accessibility Guidelines 2.2 AA, I believe that's the right configuration that we've got. So those are all there. You could click on that. And now we're getting into this particular simulation, right? So, but it begins with some informational content, anxiety symptoms. If I don't remember what those common anxiety disorders are, these are all hyperlinked back into that mental health app where we just were. Get some more information about anxiety and relevance to rehab, and now we begin their subjective assessment. So I'm going to exit out of the educator key because we're going to play, and I'm going to show you a couple of sections here. But just know that you have access to this as well. And I would say play it yourself. I do want to put a little asterisk or note here. I do think that it's important that we need to do due diligence as educators to vet these ourselves and be aware of the audience, our students in our classrooms, and be aware of any potential triggers that this might cause amongst your students. Have a plan for how you might handle those particular situations. So play these yourself. Definitely vet these before you launch them in class. But I would say this is a great in-class activity. If appropriate. It really used the simulation as classroom discussion as that catalyst. So I've actually fast forwarded the simulation a little bit. Here's just an example of our subjective assessment. So here's Tom, 58-year-old male, referred to rehab, right wrist fracture, just had a cast removed, and imaging confirmed some good alignment and bone healing, and he's now referred for rehab. So as we go through, you'll see that there are a number of these little vignettes of where the clinician, the therapist, is doing some of the communication. And then we're also listening to Tom and his response. So here's just 20 seconds of this is actually Kun Man doing the introduction.
Hi, Tom. I'm your therapist.
Hi.
I hear that you're here to do rehabilitation for your wrist after you fractured it and you just had your cast removed, right?
Yes.
Right.
Last week.
Okay. I just want to hear a little bit more from you. What led to this wrist fracture? What
Okay, so I'm going to pause that. If we were doing this in class, I might then say, what did we think she did well? What would be some improvements? What type of communication was she using here? As we click next, now we're going to hear from Tom. This would be 1 minute and 51 seconds, where he's then explaining what happened and why he might feel a little bit anxious. But I actually want to skip ahead to show you. Here's question one. And this is a select all that apply, which my students always loved. I'm sure yours do too. But when they got to that BOC exam and they're sitting there and they're like, oh, this is why Dr. Schmidt had all those lovely select all that apply. But so that the technology mirrors what they're going to see on that BOC exam. But so which of the following factors might be contributing to Tom's anxiety? We're going to select all that apply. And so the answer here is his experience of wrist pain. He distrusts his doctor, and then he suspects his fracture is not healing well. We'll click submit, right? And then we're going to get that formative feedback immediately as we go through this. And students will have the ability to go back and review anything that they've gotten wrong or right as they complete this. So let me go ahead into the next section. So I fast forward a little bit, but now we're looking at the therapist responding to Tom's concerns and worries. So let me just play a little bit of this as well.
Yeah, I mean, hand injuries are bad. A lot of people don't realize how much we need our hands for very simple things. So, yeah, hand injuries, you wouldn't want to injure your hand, compared to any other body part.
Well, okay, if you say so, I'll just do whatever you want me to do.
Oops. And then above, there is informational content as well. So it's not just the assessment, but how should I do this? And what would be an appropriate way to respond? All right. So there's some anxiety about recovery. Is that normal? Here's some hyperlinked references about this in orthopedic patients and affecting health outcomes. But here's where we make some connections to the classroom, right? The phobia disorder that I or panic disorder that I used in the example previously, we used the Beck anxiety questionnaire, right? And here Tom has completed it. So we might look at what's the score interpretation. I might zoom in on this page to see what that looks like. Okay. And then I'm asked, well, is that moderate, severe, low? Okay. The answer is moderate. I click submit. Again, I'm going to get formative feedback as I go through. If I answered that incorrect, it would also give me that feedback as well, and I could look at those interpretation hyperlinks. Okay, so then I'm also going to fast forward. I know we're getting really close to our time. We're just a little bit over our half hour, but at we get to the end, there are multiple other vignettes and videos that students will watch, both good examples and bad examples, and they have to pick out the bad or which one of these is a better approach. So there's some compare and contrast information that they need to go through. So really well done simulation. But know that at the end of every simulation that we have in ATU, there's a summary slide. So this talks about that anxiety part one summary. There's a reflection. So this is a great part to debrief. Have your students do this maybe asynchronously and come back and talk about it. They can click on, these were the objectives for the simulation. Here's some reflection questions. What is one takeaway from this module? How will it impact your next patient-client encounter? They can type this in there. I would say have them screenshot this or maybe write it down separately so they could share it with you, or they can recall it later or submit it to your LMS. Which communication technique is most challenging for you? How so? And they would respond there. And then lastly, some action items, right? What do I want to do to improve my ability to deal with patients suffering from anxiety with anxiety symptoms? And then here results, right? All of our scores are set at 80% or higher. I could go back and review each one of those as needed, but also then references. And so you could easily then hyperlink these or copy paste them into a browser to go see that particular reference. So at this time, we'll actually wrap up our time together. We'll go back to our simulation, our presentation, that is, and just have a few closing comments, and then we'll give everyone a chance to unmute and engage in any conversation if they would like. So if any of those things that we've shown today or I've shown today sounds like something that you'd like to try in your own course or curriculum before the next term starts, I do have a few slots open the next week or so for 30-minute walkthroughs. I'd love to help you integrate these resources. There's a QR code to book a meeting or send me an email. For those of you who are attending live, watching this live, you should see a resources icon at the bottom Zoom toolbar, and you can see the links tab in there. And that will give you a link to get a faculty demo, or please, again, reach out. I'm happy to address any of those questions that you might have. So before we wrap up, I do want to spend just a quick moment and have Phil come in and join our conversation here. And I know we've just recently, again, end of May 2026, sent out some emails across the board because we're really excited about supporting high school and college educators and students studying in the areas of kinesiology and sports med. So KinesiOU and sports med, and Phil is our education lead for those areas. So Phil, why don't you share just a little bit about those platforms?
Yeah, thanks, Chris. And be looking out for an email. And certainly these are two new products for us. Really, as Chris mentioned, we're really targeting that undergraduate, maybe pre-professional kinesiology student, trying to package apps that we feel are applicable to what they're learning at the undergraduate level, maybe highlighting performance lifting, which is a new app. A lot of resistance training in there. And then sports med, even more curated, perhaps for a single course. Maybe that's taught at both the high school and the college level, in which these 15 apps might be really pertinent to that single course. So reach out to us, let us know your thoughts, or if you want access, or maybe your colleagues around you might be interested as well. So appreciate it, Chris.
Yes, thank you for that. I am really excited to see how that grows and really expanding our mission to those areas. So, if you're available, our next upcoming ATU faculty webinar, we're going to take a look at how to use the built-in educator dashboard for an easy and data-driven experience as you integrate simulations into your curriculum. And that dashboard will allow you to review student progress on those simulations that I just demonstrated in real time, and then allow you to effortlessly export that data that you need for course level, program-wide outcomes assessment, and certainly those all ever important maintenance of accreditation report. So please make plans to join us. Tell any of your friends, faculty friends who might be interested. You should see a link in the register in that resources tab in the links section, or check your inbox for some upcoming invitation emails. And in case you missed any previous faculty webinar about ATU or any of our other products, you'll find a link to the on-demand webinar library in that resources section as well. If you're watching later on demand, you can visit the redesigned educator webinar page at clinicalpattern.com. So thank you everyone for joining us today, and I wish you all a very successful academic term and academic season using ATU. And at this time, I will conclude the recording.